There are really three forms of diabetes that we deal with. Type 1 diabetes is childhood diabetes. And the thing that's happened over the years is that pregnancy has become much safer and outcomes have been much better. In the old days, babies of women with diabetes just died. Now we've got all sorts of things like pumps and continuous glucose monitoring and all sorts of technology that help us get better control. And so we're getting the most wonderful outcomes for our women with type 1 diabetes. And that's been kind of a thrilling progression. Type 2 diabetes used to be something we saw very rarely. It happened in older women after they'd had their children, but we're finding it's occurring at a younger age. And also women having their babies older, and I guess obesity in the community is increasing. So for all of those reasons, we're seeing lots of women now with type 2 diabetes. So our challenge is to make sure that they prepare for pregnancy and have good healthy pregnancies and healthy babies, because their outlook is perhaps not quite even as good as type 1 diabetes. Then of course there's gestational diabetes, which is diabetes that occurs during pregnancy, and we have between 500 and 600 women with gestational diabetes here at the Women's, so we have a huge workload. We work really closely with other obstetricians and the midwives to look after those women really well, because they have to attend to their diet, they have to measure their blood glucose levels. About half of them are on insulin injections, and again we're getting really fantastic results in terms of management of gestational diabetes, but because of the numbers it's really quite a challenge.